When trauma or disease causes the loss of a tooth, a gap will be left where surrounding teeth can shift due to the forces created by chewing, grinding, or clenching. Fortunately, your dentist can offer a replacement in the form of a non-removable, custom-made ceramic bridge that is held in place using the teeth on either side of the gap. The process for installing an all-ceramic bridge first involves preparing both teeth, as an impression is taken of the teeth and surrounding areas shortly after. A temporary bridge is then used to replace the missing teeth as the impression is sent to a dental lab where the final bridge is crafted using a tooth-colored ceramic material. During your follow-up appointment, the temporary bridge that was used as a placeholder will be removed as the supporting teeth are cleaned and prepared using a bonding agent. Resin cement is then used to fix the bridge in place. Once settled, excess material is removed, resulting in a bright, white smile. When disease or trauma results in the loss of more than one tooth, an implant-supported bridge can offer an excellent solution to fill in the gaps that were left by the missing teeth. A large gap caused by several missing teeth can cause difficulty while chewing, and place unnecessary pressure on your remaining set of teeth. Receiving an implant-supported bridge requires several dental appointments that first involves the placement of implants on the jawbone. After several months of allowing the gum and bone to heal over the implant, your follow-up appointment involves the creation of the permanent bridge using impression copings. An impression of your jaw is then taken and then sent to a dental lab. After the impression is taken, the impression copings are removed and replaced with healing caps, which are left on for 2 weeks to allow for the healing process. During your final appointment, abutments are inserted on top of the implants as the permanent bridge is cemented into place. When the decision to replace one or more missing teeth with dental implants has been made, your dentist will arrange for implant surgery to be performed. Prior to the placement of the dental implant, the gap left by the missing tooth must first be prepared by a dental surgeon, who will cut through the gums and expose the jawbone. Using specialized dental instruments called implant drill bits, the bone is prepared to create a sufficient amount of space for the dental implant to be placed. Once prepared, a titanium implant fixture is inserted into the space. Once the implant is inserted, your dental surgeon will place a healing cap over the implant as it is stitched to bond with the bone and gum tissue. Time is then required to allow bone to grow over the implant and help anchor it in place. A period of 3 to 6 months is given to allow for healing. During your second appointment, the healing cap will be removed as a dental crown is placed on top of the implant. When faced with the decision to remove a tooth, the long-term consequences affecting your oral health must be taken into consideration and evaluated. When a tooth is removed or lost, the neighboring or surrounding teeth compensate by shifting into the empty space or gap. This shift in the tooth's position can result in a less than ideal dental alignment and can cause potential gum or bone recession. This can also lead to an excessive buildup of dental plaque that can eventually develop into more severe gum disease. This change in your tooth's positioning can also lead to TMJ, or temporomandibular joint disorder. This is what normal positioning should look like, while this is abnormal or dysfunctional positioning displaying pain and distress. If left untreated for a long period of time, spacing of the teeth may occur. Rather than removing a tooth, your tooth can be prepared for a dental crown or be replaced in the form of a dental implant.
मुझे लगता है कि हमें मौखिक कैंसर पर बात करने का समय आ गया है। मुझे पता है, कैंसर के बारे में चर्चा करना कभी आसान नहीं होता, लेकिन विश्वास करें, ऐसा नहीं है। विश्वास करें, इस विषय की जागरूकता बढ़ाने में मदद करने के लिए यह बातचीत एक जरूरी कदम है। बेस्ट में अगर समय पर पकड़ लिया जाए तो मौखिक कैंसर का सफलतापूर्वक इलाज करने की संभावनाएं काफी अधिक हैं। तो बाकी हम इससे सेज किस टू बशर्ट सकते हैं। नियमित मौखिक कैंसर स्क्रीनिंग के माध्यम से सरल आपके मुंह की एक सामान्य जांच के दौरान आपका दंत चिकित्सक प्री कैंसरस स्थितियों के संकेतों की तलाश कर सकता है। स्क्रीनिंग वास्तव में काफी सरल होती है और आमतौर पर आपके मुंह के कोमल ऊतकों का दृश्य निरीक्षण करके शुरू होती है। इसमें आपकी जीभ की सतह शामिल है। आके मुंह का तल Saudi Enderni hast. Aksai, Mlaima Titab. और ओवुला और टॉन्सिल को मत भूलिए। आपका दंत चिकित्सक आपके गले और जबड़े की भी शारीरिक जांच कर सकता है ताकि वे देख सकें कि क्या वे सतह के नीचे कुछ असामान्य महसूस कर सकते हैं। दंत चिकित्सकों के पास उनके उपयोग के लिए पैनोरामिक एक्सरे भी होते हैं। यह आपके ऊपरी और निचले जबड़े की हड्डियों के साथ साथ खोपड़ी के साइंस स्थानों की जांच करने में उनकी मदद करता है। अंत में आपके दंत चिकित्सक मुंह में ऊतकों को रोशन करने के लिए एक गैर आक्रामक प्रकाश उत्सर्जक दूरबीन का उपयोग कर सकते हैं। यह विधि ऊतकों में असामान्यताओं को उजागर कर सकती है, अक्सर इससे पहले कि वे अप्रशिक्षित आंखों को दिखाई देने लगे। तो याद रखें, नियमित जांच महत्वपूर्ण है, खासकर अगर आपकी जीवन शैली में धूम्रपान, शराब का सेवन या अत्यधिक सूरज के संपर्क में आना शामिल है। आज ही अपने दंत चिकित्सक से बात करें और इसे अपनी नियमित जांच का हिस्सा बनाएं।
Third molars, more commonly known as wisdom teeth, can be difficult to clean and maintain because of the tooth's misaligned position after it erupts. In an effort to avoid the problems associated with an impacted wisdom tooth, an extraction of the tooth may be an ideal solution for you. Once the decision to remove the tooth has been made, your dentist will schedule an appointment with a dental surgeon, where the extraction site will be thoroughly numbed. Your surgeon will then make an incision to expose and remove the gum tissues that lie on top of the impacted wisdom tooth. The removal of the tooth includes cutting and dividing it into much smaller parts, thus minimizing the amount of bone that needs to be removed to take out the tooth, which in turn helps to reduce lengthy recovery times.